Did you know that something as simple as not drinking enough water during pregnancy could lead to premature contractions, low amniotic fluid, and even birth defects? And yet, most pregnant women have no idea how much water they actually need each day. Today, we are doing a deep dive into one of the most overlooked topics in prenatal care: hydration during pregnancy. By the end of this video, you'll know exactly how much to drink, when to drink it, what to avoid, and the warning signs that your body is telling you it's running dry. Stay until the end, because I've got a free daily hydration tracker tip that is going to change how you approach this. Let's get into it. Segment 1: Why water is so critical during pregnancy. Before we talk numbers, let's understand why water is so incredibly important when you're growing a human being inside you. Your body during pregnancy is not just sustaining one life, it's sustaining two. And water is at the center of almost every single process happening inside you right now. Here's what water does during pregnancy. Number 1, it forms amniotic fluid. That cushioning fluid surrounding your baby, it's mostly water. Without adequate hydration, amniotic fluid levels drop, a condition called oligohydramnios, which can restrict fetal movement and development. Number 2, it supports increased blood volume. During pregnancy, your blood volume increases by up to 50%. That's extraordinary. And water is essential for producing all of that extra blood to carry oxygen and nutrients to your baby through the placenta. Number 3, it helps build new tissue. Every new cell in your baby's growing body, every organ, every muscle, every bone, requires water to form. You are literally building a person, and water is a primary construction material. Number 4, it regulates body temperature. Pregnant women run warmer. Your metabolism is working overtime. Water helps you cool down and prevents dangerous overheating, especially in the second and third trimesters. Number 5, it aids digestion and prevents constipation. Ah, yes, one of the less glamorous parts of pregnancy. Constipation is incredibly common, especially due to prenatal iron supplements. Water keeps things moving. Number 6, it flushes out waste and toxins. Your kidneys are filtering waste for 2 people now. Water helps your kidneys do their job efficiently and reduces the risk of urinary tract infections, which are more common and more serious during pregnancy. Number 7, it reduces swelling. Counterintuitively, drinking more water actually helps reduce the fluid retention and swelling, called edema, that so many pregnant women experience in their feet, ankles, and hands. So now that you understand the stakes, let's talk about exactly how much you need. Segment 2. The exact numbers. How much water do you need? This is the question everyone wants answered, so let's be very clear and specific. The general guideline from the American College of Obstetricians and Gynecologists, ACOG, is 8 to 12 cups of water per day. That's 64 to 96 ounces, or approximately 2 to 2.4 liters daily. But here's what I want you to understand. That's the baseline. Your actual needs will vary depending on several factors, and I'm going to walk you through all of them. Water needs by trimester. First trimester, weeks 1 to 12. Your baby is still very small, but your body is working incredibly hard. Morning sickness is common, and vomiting causes significant fluid loss. Aim for the lower end of 8 to 10 cups, but if you're experiencing nausea and vomiting frequently, you may need to replace even more. Pro tip: if you can't stomach plain water due to nausea, try cold water with a squeeze of lemon or lime. Many women find the citrus scent helps with nausea too. Second trimester, weeks 13 to 26. Your blood volume is increasing significantly. Your baby's growth is accelerating. This is when you should be pushing toward 10 to 12 cups daily. Your energy is typically better in the second trimester, which makes it easier to stay consistent with hydration habits. Third trimester, weeks 27 to 40. Your body is at peak demand. Amniotic fluid levels, circulation, temperature regulation, all at maximum. Many doctors recommend 12 cups or more, especially in the summer months or if you're physically active. Dehydration in the third trimester is linked to Braxton Hicks contractions, the practice contractions, and in some cases, true preterm labor. If you ever experience regular contractions before 37 weeks, drink a large glass of water and call your doctor. Factors that increase your water needs. Di-E. Hot weather or humid climate. You sweat more, you lose more, you need to drink more. Add 1 to 2 extra cups on hot days. 2. Physical activity or exercise. If you're doing prenatal yoga, walking, or swimming, excellent. Just add at least 1 to 2 cups for every 30 to 60 minutes of activity. 3. Multiple pregnancies, twins, triplets. If you're carrying more than one baby, your fluid requirements are higher. Discuss specific targets with your OB. 4. Breastfeeding preparation. In the later weeks, your body begins preparing for milk production. Staying well hydrated now supports a healthier milk supply later. 5. High altitude. Living or traveling above 8,000 feet increases fluid loss through breathing. Increase intake accordingly. 6. Illness, fever, diarrhea, vomiting. Any condition causing fluid loss demands immediate replacement. Don't wait. Drink. A simple formula to personalize your intake. Here's an easy way to calculate. Take your pre-pregnancy weight in pounds, divided by 2 equals ounces of water per day. Then add 24 ounces for pregnancy. For example, if you weigh 140 pounds, 140 divided by 2 equals 70 ounces plus 24 equals 94 ounces per day. That's about 11.75 cups. Very close to the standard recommendation. Write that number down. That's your personal daily target. Segment 3, the signs of dehydration in pregnancy. Now let's talk about something critical, how to know if you're not drinking enough. Because dehydration during pregnancy can sneak up on you, and some of the signs are easy to dismiss or misattribute. Mild to moderate dehydration signs. Dark yellow or amber urine. This is your most reliable daily indicator. Your urine should be pale yellow, like lemonade. If it's dark yellow or orange, drink water immediately. Infrequent urination. Pregnant women typically urinate frequently. If you're going less than every 2 to 3 hours, you may be dehydrated. Headaches. Very common in pregnancy, but dehydration is a leading cause. Before reaching for Tylenol, drink a full glass of water and wait 20 minutes. Dizziness or lightheadedness, especially when standing up quickly. Dehydration lowers blood pressure and reduces blood flow to the brain. Dry mouth or dry lips. Fatigue or unusual tiredness. Yes, pregnancy is tiring, but dehydration makes it significantly worse. Muscle cramps, particularly in the legs at night. Classic sign of inadequate fluid and electrolyte intake. Constipation. If things aren't moving, water is usually part of the solution. Severe dehydration. Seek medical attention immediately. Contractions or uterine cramping, especially before 37 weeks. Drink water and call your doctor. Rapid heartbeat. Confusion or difficulty concentrating. No urination for 8+ hours. Sunken eyes or very dry skin. Fainting. These are emergencies. Don't try to manage severe dehydration at home during pregnancy. Go to your OB, midwife, or emergency room. The quick daily check. Every morning, look at the color of your first morning urine. Use it as a hydration report card for the previous day. Dark? Drink more today. Pale yellow? You're on track. Completely clear? You may actually be overhydrating, which is rare, but worth mentioning. Can you drink too much water? Yes, it's possible. Drinking excessive amounts, more than 3 to 4 liters in a very short period, can cause a dangerous condition called hyponatremia, where sodium levels in the blood drop dangerously low. This is extremely rare, but it is real. Stick to your daily target spread throughout the day. Don't try to chug it all at once. Segment 4, what to drink and what to avoid. Okay, so now you know how much. But what should you be drinking? Because not all fluids are created equal. The best beverages for pregnant women. Dai, plain water, the gold standard. Nothing beats it. Filtered water is ideal if you have concerns about your tap water quality. If you live in an area with fluoridated water, that's actually beneficial for your baby's developing teeth and bones. 2. Infused water. If plain water feels boring, add flavor naturally. Cucumber and mint, lemon and ginger, strawberry and basil. This makes hydration more enjoyable without adding sugar or artificial ingredients. 3. Coconut water. A great option for replenishing electrolytes, especially after exercise or illness. It contains natural potassium, magnesium, and sodium. Choose plain, unsweetened varieties with no added sugars. 4. Herbal teas, specific ones only. Some herbal teas are perfectly safe and even beneficial during pregnancy. These include ginger tea, excellent for nausea. Peppermint tea, helps with digestion. Rooibos tea, caffeine-free, rich in antioxidants. Red raspberry leaf tea, traditionally used in the third trimester to tone the uterus. Check with your doctor before using. Piate, milk, dairy or fortified plant-based. Provides hydration plus calcium and vitamin D. Great choice, especially in the second and third trimesters. 6. Diluted fruit juice. 100% fruit juice diluted 50-50 with water gives you flavor, a bit of natural sugar for energy, and hydration. Don't go overboard with undiluted juice due to high natural sugar content. 7. Broth or souper. Counts toward your fluid intake and provides minerals and electrolytes. Excellent choice if you're struggling with nausea and can't keep solid foods down. Beverages to limit or avoid. Caffeine, limit. Caffeine is a mild diuretic, meaning it causes you to urinate more. Current guidelines recommend limiting caffeine to 200 milligrams per day or less during pregnancy. That's roughly 1 12-ounce cup of coffee. If you're counting on coffee for hydration, be aware it works slightly against you. High caffeine beverages, coffee, espresso, black tea, green tea, many energy drinks. Sugary drinks, limit. Sodas, sweetened juices, sports drinks, and flavored waters with added sugar contribute to excessive weight gain and gestational diabetes risk. An occasional treat is fine, but they should not be your primary hydration source. Energy drinks, avoid. Most energy drinks contain high levels of caffeine, B vitamins in excess doses, herbal extracts like guarana, and other stimulants that are not safe during pregnancy. Just avoid them entirely. Alcohol. Avoid completely. There is no known safe amount of alcohol during pregnancy, period. Alcohol crosses the placenta directly to your baby and can cause fetal alcohol spectrum disorders, FASDs. Zero alcohol. Zero exceptions. Unpasteurized juices or drinks. Avoid. Raw, unpasteurized juices from juice bars or home juicers may contain harmful bacteria like E. coli, listeria, or salmonella, which are particularly dangerous during pregnancy. High-sugar sports drinks. Limit. Gatorade and similar drinks are fine in moderation if you've been exercising heavily and need electrolyte replacement. But they're not necessary for everyday hydration and contain significant amounts of sugar and artificial dyes. Herbal teas to avoid. Chamomile in large amounts can stimulate uterus. Licorice root. Black cohosh. Pennyroyal. Sage. Erfrischanters. Chiacha stepwars. Parsley tea. Nettle in large amounts. When in doubt about any herbal product, ask your midwife or OB first. Segment 5. Practical strategies to hit your daily water goal. Knowing you need 10 to 12 cups of water is one thing. Actually drinking it every single day, especially when you're dealing with nausea, heartburn, frequent urination, or just the general exhaustion of pregnancy, is another challenge entirely. Here are the strategies that actually work. Strategy 1. Start before you get out of bed. Keep a glass or bottle of water on your nightstand. The moment you wake up, drink 8 to 16 ounces before you even stand up. You wake up mildly dehydrated every morning. This jumpstarts your hydration and your digestion. Strategy 2. Use a marked water bottle. Buy a 32-ounce or 1-liter water bottle marked with time goals. Drink to here by 10 a.m., here by 1 p.m., here by 4 p.m. This visual cue is incredibly powerful. Many pregnant women use a 32-ounce bottle and aim to refill it 3 times per day. Strategy 3. Tie drinking to existing habits. Drink a glass of water before every meal, after every bathroom trip, which you'll be doing frequently, every time you take your prenatal vitamin, and before bed. These hydration anchors add up without requiring you to remember constantly. Strategy 4. Use a hydration app. Apps like Waterminder, HydroCoach, or even a simple habit tracker on your phone can send you reminders throughout the day. Set an alert every hour if needed. Strategy 5. Eat your water. About 20% of your daily fluid intake can come from food. High water content foods to incorporate. Cucumber, 95% water. Celery, 95% water. Watermelon, 92% water. Strawberries, 91% water. Peaches, 89% water. Oranges, 88% water. Soup and broth. Yogurt. Adding these to your diet naturally boosts your hydration without drinking more. Strategy 6. Managing hydration with morning sickness. If nausea is making it hard to drink, sip small amounts frequently instead of large glasses. Try cold or ice water. Many women tolerate cold water better when nauseous. Add lemon or ginger to your water. Try drinking through a straw. Sparkling water or seltzer may feel easier on an upset stomach. Popsicles made from water, coconut water, or diluted juice count as fluid. Strategy 7. Taper off in the evening. Yes, you need to drink enough water, but chugging it all in the evening means constant nighttime bathroom trips, which destroys your sleep. Try to get 75% of your water intake done by 5 p.m., then sip lightly in the evening. Strategy 8. Track for 1 week. You don't have to track forever, but track for 7 days to understand your baseline. Most people are shocked to discover how far below their target they actually are. Once you see it in writing, your habits tend to shift. Segment 6. Hydration and common pregnancy complications. Let's connect hydration to some of the most common complications in pregnancy, because this is where it gets really important. Preterm labor. Dehydration is one of the most common triggers of preterm contractions. When you're dehydrated, your body produces a hormone called vasopressin. This hormone is structurally very similar to oxytocin, the hormone that causes labor contractions. So dehydration can literally trigger your uterus to contract early. The takeaway: if you feel contractions before 37 weeks, drink 2 large glasses of water, lie on your left side for 30 minutes, and call your OB if they don't stop. Urinary tract infections, UTIs. Pregnant women are significantly more susceptible to UTIs due to hormonal changes affecting the urinary tract. Inadequate hydration concentrates your urine, creating an environment where bacteria thrive. Staying well hydrated flushes bacteria out of the urinary tract regularly. Neural tube defects. Research suggests that adequate hydration in the very early weeks of pregnancy, often before women even know they're pregnant, supports the formation of the neural tube, which becomes the baby's brain and spinal cord. This is one reason hydration is important, even when trying to conceive. Gestational hypertension and preeclampsia. While dehydration alone doesn't cause preeclampsia, proper hydration supports healthy blood pressure regulation and kidney function, both of which are central to this serious condition. Low amniotic fluid, oligohydramnios. If your provider mentions your amniotic fluid levels are on the lower side, the first recommendation is often to increase water intake significantly, sometimes called aggressive oral hydration. It sounds simple, but it works. In some cases, drinking an additional 1 to 2 liters per day has been shown to meaningfully increase amniotic fluid levels. Constipation and hemorrhoids. Both extremely common in pregnancy, both significantly worsened by dehydration. Water softens stool, makes bowel movements easier, and reduces straining, which is the primary cause of hemorrhoids during pregnancy. Muscle cramps. Those terrible leg cramps at night? Often a combination of dehydration and magnesium/potassium imbalance. Drinking more water and eating bananas, avocados, and leafy greens can make a significant difference. Segment 7. Hydration during labor and postpartum. Quick but important. Don't forget about hydration during labor and after delivery. During labor is intense physical work. You sweat, you breathe hard, you lose fluids. Many hospitals provide IV fluids, but if you're in an early labor at home or in a birthing center setting, keep sipping water or ice chips regularly. Immediately postpartum, if you're breastfeeding, your fluid needs jump dramatically. The general recommendation is to add at least 16 extra ounces, 2 cups, per day beyond your pregnancy intake for breastfeeding. Many lactation consultants recommend keeping a large water bottle at every nursing station in your home. Even if you're not breastfeeding, your body needs significant hydration to recover from labor, replace blood loss, and begin healing. Okay, let's do a quick recap of everything we covered today. Pregnant women need 8 to 12 cups, 64 to 96 ounces, of water daily, more in heat, during exercise, or in the third trimester. Water supports amniotic fluid, blood volume, tissue development, and so much more. Urine color is your best daily indicator. Aim for pale yellow. Watch for signs of dehydration, dark urine, headaches, dizziness, contractions. Best drinks: plain water, infused water, herbal teas, coconut water, milk. Avoid alcohol completely. Limit caffeine to 200 milligrams per day. Skip energy drinks. Use practical strategies: morning glass, marked bottles, habit anchors, high water foods. Water is the simplest, cheapest, most effective thing you can do for your health and your baby's health every single day. Don't overcomplicate it, just drink more. If this video helped you, please give it a thumbs up. It helps other pregnant mamas find this information. And drop a comment below. What trimester are you in, and how much water are you drinking daily? I read every single comment. Don't forget to subscribe if you're new here. We post new pregnancy, birth, and postpartum content every week. And if you want a free daily pregnancy hydration tracker, check the link in the description below. It's completely free and printable. I'll see you in the next one. Take care of yourselves and those beautiful babies. Bye for now.